Okay.
Leopold's maneuver. Leopold's maneuver is standard palpation of the abdomen, assessing for the fetal position, presentation, degree of descent, and also to locate the fetal heart zone, also to know the number of fetus, and also to know the attitude. The equipments needed for the procedure is the pillow, top sheet or blanket, tape measure, and also the stethoscope. Stethoscope is used to locate the fetal heart zone, and the tape measure is used to measure the fundic height. Good morning, ma'am. I am Liji Wednesday Okebuyin, your student nurse for today. Is it okay with you that I'll be your nurse for today? Okay, thank you. And ma'am, may I know your name and age po? Okay, great. And now let's start. First thing to do is check the client's chart and read the doctor's order for the said procedure. This is to ensure that you are administering the procedure to the right client. And the second is, do the client assessment. Obtain the obstetrical history for the patient, parity, gravida score, LMP, ADC, EDD, AUG, and also measure the fundic height. And don't forget to get the vital sign. And the rationale for this is to gather data would make computation accurate. Next is explain the procedure to the client. The rationale for this is to elicit cooperation of the client, and it reduces apprehension and encourage cooperation. Ma'am, this is the procedures. The first maneuver is to locate the head and buttocks. And the second maneuver is to locate the fetal back, knees, and elbows. And the third maneuver is to note the presentation of the fetus if it is cephalic, breech, or transverse. And lastly, the fourth maneuver is to note the attitude of the fetus. Are you done urinating, ma'am? Before the procedure starts, you must empty your bladder first. And the rationale for this is to avoid discomfort during the procedure. And next is gather all equipment needed to save time and energy, and do the proper hand washing. To do the proper hand washing, this is to prevent the spread of pathogens. Provide the client privacy to ensure the client cooperation during the procedure. Place a woman to a dorsal recumbent or a supine position, and place a pillow under her head. And let the client knee reflex to relax abdominal muscle. And the rationale for this is to make client comfortable. Ma'am, flex lang nato ato ang mga tail, ma'am, ha. Okay, thank you. Drape a client using top sheet or a blanket. Excuse me, ma'am. Tabo lang ta, mama. Rub each hand together to produce warmth. And make sure that before touching client's abdomen, your hand is warm. This is to prevent startling. Expose only the client abdomen. First maneuver is a fundal grip. Using both hands facing the client, feel for the fetal part laying in the fundus. And determine the shape, size, mobility, and consistence of what is being palpated. The findings of it is the head is more firm, hard, and round that moves independently through the body. Breech is well defined that moves only with the conjunction of the body. The second maneuver is the umbilical grip. One hand is used to steady in the uterus, and the other side is slightly move in the circular motion. Use gently but deep pressure, and repeat the step on the opposite side using the opposite hand. The findings of the second maneuver, fetal back, is feels smooth, hard, and resistant surface. Knees and elbows of the fetus fills with the angular number of nodulation. Third maneuver is a Pollock grip. Using thumb and finger, grasp the lower portion of the abdomen above symphysis pubis. Press in slightly and make gently movements from each to side. And the rationale for this is the thumb finger use would help determination of the presenting part either engaged or not engaged yet. The third maneuver findings is the presenting part is engaged if it is not movable, and it is not engaged if it is still movable. Fourth maneuver, pelvic grip. Facing foot part of the woman, palpate the fetal head pressing downward about 2 inches above inguinal ligament. And the findings of it is if it is good attitude or poor attitude. Place a client to its proper and comfortable position. And the rationale for this is to make client relax after the procedure. And next is do the hand washing. To do the proper hand washing is to reduce the transmission of microorganisms. And lastly is to document the procedure and assessment during the care. Careful record is important for documentation after client care, and it must be timely and accurate for the continuity of care. And don't forget to say thank you to the client. Ma'am, thank you for your cooperation, ma'am.